So this is Bob Dannenhoffer. We had a little glitch there. Phone ran out. So Laura says, what's the average time frame showing signs or symptoms after possible exposure? So almost all of our cases are running right at 5 or 6 days. Again, the range is 4 to 12 days, but I think most of ours have been running right at 5 or 6 days. So I have to look very carefully for that. And the other question is, do all COVID patients have fever? About 80 or 90% do. Sorry about that. Well, I'm sideways, but I have a face that's made for radio, so just turn your phone here. So do all COVID positive patients have a fever? No, about 80 or 90% do, but fever actually has been unusual with this, and fever is not super high, unlike flu or measles, where fever is very common, almost every case, and very high. Not so much here, especially in kids and in super old people. All right. So the other question was, I heard there were no new cases today, and then are you saying there are no new cases today? Well, it's really confusing, and we're going to work on this next week, because as cases come in very quickly, what happens is when a case comes in and goes through the state system, we then find it and work it up. The state counts cases at midnight, we count cases at noon, and so our cases are always going to be more than the state, because the state picks up all the cases they got to midnight, we pick up all the cases to noon. But this is confusing a lot of people, so we're going to work next week so as to not confuse people. So, we've had a couple of new things in this last week that are confusing people: presumptive cases, recovered cases, the difference between the state count and our count. So we're going to work and try and make that there. I can tell you that our numbers are absolutely great. We have never needed to retract or do anything else. Our numbers are right on board. So Patty said, and I think we lost this when the phone went out, we'll be having up to 900 cases per day in Oregon. Is that true? And again, the 900 cases would mean the 900 infections a day. Now, we do not find every case, right? There's some people who are asymptomatic, some people are mildly symptomatic and don't get treated. We think we're catching about a third of the cases as confirmed. So that would mean that there would be 900 total infections and 300 we pick up. But I will tell you, this has been an incredibly hard thing to predict. And I think I've stopped predicting because we've been off so much. I really thought after we came down that we would stay down. I don't think any of us predicted that it would rebound quite so quickly as it has. Now, that may be related to this change in the spike protein, but I think it's also related to the change in the amount that people are traveling. Before this, the freeways were busy. During the lockdown, the freeways got really empty, but they're back to about where they were before. When I go to the grocery store, it was busy, got very unbusy, but it's busy as it was before. I see all the people that are out at games and parties and whatever. So I think we're mixing more. The virus may be more contagious, and I think we may have let up our guard a little too soon, but we'll see in the next little bit. All right. So let me go through a few more things. So we're making progress on the vaccines, and the progress on the vaccines is good. The vaccines that are out there are new vaccines. Again, we've never had a vaccine for a coronavirus before. So we'll see what happens here. The FDA said that they're going to say a vaccine is effective if it decreases the rate of infection or severe disease by 50%. That would be good. So 50% less disease, 50% less infection would be great. At 50% less disease, this would go from being an exponentially increasing infection to one that would be more under control. So that would be a good thing. But again, these vaccines are just now starting in phase 3 trials. You're going to need a lot more people tested before we know this is good. And then it's going to be a little hard to know if it works. So those of us who've been following this have been seeing, how would you test to see if it works? Would you, give it to a lot of people and see if they got a decreased rate of disease? Would you give some people a vaccine and some people a placebo and then purposely infect them? It's a little risky, right? Because there's no real treatment for it, so that would be problematic. However, if you just give it to people and see if they get the disease, because still the numbers of people get the disease is still less than 1% of the population, you would need to give a zillion people the vaccine to know if it worked. All right, so I wanted to get my daughter tested because all 3 kids have had bad cough for 2 or 3 weeks. Their doctor said there was not a test for children under 15. Well, that's not true. The test can be done in anybody at any age. So I don't know what that means. So how's that in keeping the children aren't getting COVID? No, anybody can get the test. The kids under 15, we're not doing in the drive-through clinic. And we're not doing in the drive-through clinic because kids less than 15, some will need to be held down to do this test. You know, you're sticking this Q-tip in 5 inches or so. And kids are not going to just sort of sit there and let you do it. And because of that, we've not wanted to do that in the drive-through clinic because it's hard to hold kids down in the car. And we don't want to do it in their car seat because we don't want them to not want to be in their car seat. But we can do it in the office. We've done a few in the office at Aviva this week, so it can be done. So if your doctor has questions, come and give me a call. So when do you think we will see the vaccine given to the public? I don't know. I mean, Dr. Fauci said in the beginning that would be a year and a half from when he said this in February. So I think that's about right, between February and August of next year. Now, there may be some vaccine for trials. There may be some vaccine for high-risk people in the months before. But to get this all going, I think it's likely to be his original prediction of February through August. Could be a little earlier, could be a little bit later. And again, remember, we're not always successful at making a vaccine. We have tried like crazy to make a vaccine for HIV and haven't been able to do it. We have been trying like crazy to make a vaccine for malaria, and we really have made very little progress. So, you know, I'm hopeful that it's going to work, but I certainly don't see a guarantee. And then when we make these vaccines, there are so many things along the way they're going to make it complicated. So, I mean, one of these is just this weird glass that you put vaccines in called borosilicate glass. There's a shortage of that. So we have so many different steps along the way to get this here. And then when we get it, how are 100,000 people in Douglas County going to get the vaccine? You know, we did our drive-through clinics, which were great, but we did a few hundred. What's going to do if we're going to need to do a few thousand every day? That's going to be hard. So Veronica says, do you ask those who were tested positive if they were at a protest? I heard they're not asked. No, we ask people wherever they were. And so we go through their days before they were symptomatic and the days that they became symptomatic, where they were at each of the time. Now, again, as I said before, people don't always tell us that they were at the adult bookstore or protest or at somebody else's house. But we think people have been pretty honest. And I think when I look at the people who've gotten it, I don't think many of these people are in the demographic of the protest. Again, most of the people who have this give a convincing history that they got this disease from somebody, either when they were out of state or somebody who came into the state and was positive. Okay, well, the questions are slowing down, maybe because of our little technical glitch here. But thank you for bearing with us, and thank you for all the questions. We're going to do this again on Monday, and we'll do this. Oh, we're going to do this on Tuesday. Oh, I forgot. We're frequently doing these on Mondays and Fridays, but I was just reminded that we're doing them on Tuesdays and Fridays. So we'll see you at Tuesday at 6 o'clock, and I'll be sure the phone is charged on that day. Again, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Thank you.